We're continuing on with our discussion with evidence-based practice using the acronym PICO: patient problem, intervention, comparison, intervention, and outcome. For this scenario, we have a patient that I would dialyze in, say, the orthopedic ward, who has suffered from a broken bone, leg, hip, etc. That the dialysis patient has can have high phosphorus levels in their blood due to the fact that dialysis will only excrete a small amount of it. So the patients are encouraged to limit their intake of high phosphorus foods and take their phosphorus binders that help their body excrete excretes phosphorus through normal body waste. The 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 patient problem would be the dialysis patient with a broken bone. The intervention would would be education on what high phosphorus foods are, and to avoid them, and education on phosphorus binder medication, such as Foslo, which is a common phosphorus binder dialysis patients take. The comparison intervention would be would be just um, would be just taking their would be just education on the Foslo, and the outcome would be less hospitalizations due to broken bones and osteoporosis. Now, what makes this scenario interesting is that there's two modes of education that would have two different outcomes. And the better intervention here would be the two pronged educational approach about limiting their intake of high phosphorus foods and taking their binders as well. That two pronged approach is better because you're combining two educational components into one for a better patient outcome. If one were to just focus on limiting, or pardon me, if one were to focus on just educating them on high phosphorus foods and not to eat eat them, or the importance of taking their binders, I think if the nurse educated them on both, the patient outcome would be much more successful. And that's what we as nurses are trying to seek. We What we want is the best available uh, care that we can give for our patient based on the best evidence that is available in the research community. So thank you for watching this, and I hope that this shed more light on scenario number 2.